Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. I've been trying to manage my diabetes better since our last visit, but I had a slip-up with the dosage of my medication, which caused my blood sugar levels to spike. Thankfully, they're back under control now. I've also been struggling to fit exercise into my busy schedule. I work most days of the week, often switching between early and late shifts, which makes it hard to find a consistent time for physical activity.
I understand that must be challenging, especially with your work hours. It's good to hear your blood sugar levels are back under control. How have you been managing with the iron supplements and any side effects?
The iron supplements have been okay, but I've had to deal with some constipation, which I've been managing with Docusate Senna. My latest labs showed that my iron saturation is still low, even after we reduce the dosage. It's a bit frustrating.
Thank you for updating me on that. We'll keep the current regimen since your body still needs it. You mentioned earlier that you were experiencing some intermittent lightheadedness. Has there been any improvement or changes in those symptoms?
No, the lightheadedness is still there occasionally. It's not severe, but it does concern me sometimes, especially when I'm at work. On top of this, I'm worried about the low platelets issue that has been ongoing for a while now.
Yes, I see here that your platelet count has remained low since 2009, which is indeed concerning, especially with the increased bleeding you mentioned. The referral to a hematologist is a good step to further investigate this. Regarding your cardiac health, it's great to hear that the chest pains have resolved. Have you made any specific changes that helped improve this?
I've been more diligent with my medications and trying to eat a bit healthier, which might have contributed, but honestly, I haven't made any major changes, so it might just be a fluctuation.
Keeping up with medication and a healthy diet can definitely contribute to such improvements. Now, regarding your cholesterol, the levels are still quite high, which is a concern. We'll need to address that more aggressively.
Yes, I remember you mentioned that last time. I've been trying to cut down on fatty foods, but it's been a bit of a challenge with my schedule. Sometimes I end up eating what's available rather than what's healthy.
I see. It's often difficult to balance diet and a busy work life, but we'll think about how we can support you better in managing your cholesterol. Let's also talk about your physical activity. You mentioned difficulties with finding time. Any particular days or times that might be more consistent for you?
Well, I do have some lighter days, typically midweek. Maybe I could try walking in the park nearby after work. It's just getting started. That's tough for me.
Starting is often the hardest part, but perhaps marking it on your calendar as an appointment with yourself could help make it a routine. Now let's review your current medications and make sure everything is on track. You're currently on medications for diabetes, blood pressure, cholesterol, and the iron supplements, correct?
Yes, that's correct. I've been keeping up with them as best as I can.
Great, let's make sure you have enough refills to continue your treatment without interruption. Now let's go over your latest lab results and next steps. Your A1C is currently at 7.8%, which is a bit high. We aim to get this lower to reduce the risk of diabetes complications. Your fasting glucose was also elevated at 162 milligrams, so we definitely need to think about adjusting your diabetes management.
I was afraid you'd say that. I know it's important to get those numbers down.
It is, but I'm confident we can manage this together. For your cholesterol, your LDL and triglycerides are quite high, which is a concern given your history of chest pain. We'll consider tweaking your medication there as well. Your liver and thyroid function tests look good, and your vitamin D is at the lower end of normal, which is still within range. For your next steps, continue with your current medications, and we will monitor your blood sugar levels closely. I want you to follow up with the hematologist for your low platelets, and we will recheck your vitamin levels and other parameters in a few months. Let's also aim to get you more active, which will help with both your diabetes and cholesterol levels.
Thank you, Doctor. It sounds like a solid plan. I'll make sure to book my follow-up appointments and start working on integrating more exercise into my routine.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been feeling really overwhelmed with all the health issues lately. It all started with that fainting episode last month. I woke up feeling dizzy, and the next thing I knew, I was on the ground. My family found me and took me to the hospital.
I understand that must have been quite frightening for you. What did the doctors say at the hospital?
They told me my kidneys weren't functioning properly, which led to acute renal failure. Soon after, I developed pulmonary edema and ended up in the ICU. It was a very tough time. I was really scared.
That sounds very intense. How did your condition progress after the ICU?
Well, since getting out of the ICU, I've had to go to the emergency room twice. The first time was for bleeding, and then I had blood clots in my legs. It's just one thing after another.
Were these issues resolved in the emergency room?
Partially, yes. They managed the immediate problems, but then I had to see a urologist. I've had bleeding issues, which led them to place a couple of stents. They've been talking about possibly removing them, but nothing's decided yet.
I see. And how have these health issues affected your daily life?
It's been hard. I can't move around much without feeling tired, and I haven't been sleeping well at all. I wake up every few hours. I think it might be my restless legs bothering me more than usual.
Sleep disturbances can definitely complicate recovery. Have you noticed any other ongoing symptoms?
Yes, even though the urine is clear now, it was like cranberry juice for a while. Thankfully, it's not painful to urinate, but I do have to go more frequently.
It's good that there's no pain, but the frequency is something to keep an eye on. Have you been able to follow the instructions provided in terms of fluid intake and physical activity?
I'm trying to manage my fluid intake and do some light exercises as they suggested. It's just hard to balance with feeling tired all the time.
I understand. Balancing these can be challenging, especially with your symptoms. Let's look at your most recent test results and see how they align with your symptoms. Your blood pressure is stable at 130/60, which is good. However, your heart rate was a bit elevated at 104 BPM.
Is that very bad?
It's slightly higher than normal, but can be expected given your recent health events and stress. Your kidney function tests show a creatinine of -4 mg and a BUN of 22 mg/h. Your eGFR is 55 milliliters per min minus 73 ml², which indicates some degree of renal impairment, but it's stable compared to the last tests.
What about the other tests?
Your hemoglobin is 1 to 2 Grove-Diller, hematocrit 40%, and platelet count at 150,000 per microliter, which are within a reasonable range, though we need to monitor your low platelets closely. Your morning fasting blood glucose is a 22 mg/L, which we should continue to manage with your diabetes medications.
What are the next steps then?
Given your history and recent issues, it's important to follow up closely with urology about the bleeding and stents. We should also complete the echocardiogram to assess your heart. It's crucial to keep monitoring your blood pressure and manage your diabetes carefully.
And what about my trouble sleeping and restlessness?
I think it would be wise to consult a specialist about possible sleep apnea and to better manage your restless leg syndrome. This could improve your quality of sleep, which is vital for your overall health and recovery.
Okay, thank you, doctor. I'll make sure to follow up on all these points.
You're welcome. It's important to address each issue comprehensively. Keep monitoring your symptoms, and we'll adjust the treatment plan as needed. I would like to see you again in 3 months or sooner if your symptoms worsen. Remember, managing these conditions effectively will involve a collaborative effort between you and your healthcare team.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
It's crucial to have a healthcare proxy, someone who can make decisions about your health if you're ever unable to. Have you given any thought to who you would want that person to be?
Yes, I think I would like my daughter to be my healthcare proxy. She's very familiar with my health history, and I trust her judgment.
That sounds like a wise choice. Have you discussed this with her? Is she prepared to take on this responsibility?
We've talked about it, and she's agreed to do it. What do we need to do next?
I'll provide a form for you to officially appoint her. This document needs your signature and hers to be legally valid. It's also a good idea to discuss your healthcare preferences with her in detail.
How will this document be used in the future?
If you're ever in a situation where you can't communicate your healthcare decisions, this form allows your daughter to make those decisions on your behalf. We'll keep a copy in your medical records, In any emergency or when decisions need to be made, we'll refer to this document.
That's reassuring. I'll make sure we complete the paperwork promptly. Thanks for helping me sort this out, Doctor.
Now look at question 26.
Welcome everyone. Today we're going to focus on medical incident debriefing, a critical component of our patient safety and quality improvement efforts. After any significant medical incident, it's essential that we come together to debrief. The goal of these debriefings is not to assign blame, but to understand what happened, why it happened, and how we can prevent similar incidents in the future. This requires open and honest communication from all involved staff. We'll go through each step of the incident, discuss what was expected versus what occurred, and identify any system or process failures. It's vital for learning and for fostering an environment where everyone feels safe to contribute. Does anyone have any specific questions on the debriefing process or any particular concerns about how these meetings are conducted? It's crucial that we all feel comfortable with this process, as it directly impacts our ability to care for our patients safely.
Now look at question 27.
Before your operation, we'll complete the peri-operative checklist together. This checklist is a critical safety tool to ensure that all necessary pre-op procedures have been completed. First, can you confirm your name and date of birth for me?
Yes, my name is John Doe, and my birth date is June 15th, 1980.
Thank you, John. Have you had any changes in your health since your last visit?
No changes.
Okay, let's confirm your surgical site and the procedure you're scheduled for. Can you tell me which area of your body will be operated on and what the operation is for?
It's my left shoulder, and the procedure is for a rotator cuff repair.
Perfect, that matches our records. Now, do you have any allergies to medications or materials, such as latex or certain anesthetics?
No known allergies.
Excellent. Lastly, it's crucial that you've had no food or drink since midnight. Can you confirm that?
Yes, I haven't eaten or drunk anything since last night.
Great, we've completed the checklist. Do you have any questions about the procedure or anything else regarding your care today?
Now look at question 28.
Welcome to our hospital volunteer orientation. Today, we're going to discuss what you can expect during your time volunteering with us, the roles you may be assigned, and the critical importance of adhering to hospital policies and procedures. As volunteers, you provide invaluable support to our staff and patients. Whether you're guiding visitors, assisting in patient wards, or helping with administrative tasks, Your role is crucial. You must adhere strictly to all privacy and safety protocols. Confidentiality is paramount as you might handle sensitive information or witness private situations. Always respect patient privacy and staff instructions. You'll receive specific training based on the area you'll be working in. This includes handling patient information, understanding hospital layout, and knowing whom to contact in different situations. Are there any specific concerns or questions about what you've heard so far? It's important that you feel prepared and informed as you start this journey with us.
Now look at question 29.
We're going to use the Wong-Baker Faces Scale to help understand how much pain your child is feeling right now. Can you help him point to the face that shows how he feels?
He's pointing to face number 4, which indicates moderate pain. Based on this, we can administer some medication to help relieve his discomfort. It's important we manage his pain effectively.
Monitoring his pain this way helps us adjust pain management strategies as needed and ensures we're responding appropriately. How do you feel about this method? Do you think it helps him communicate his pain better?
If at any point you feel his pain isn't being managed adequately, please let us know. It's crucial for his recovery that he remains as comfortable as possible. Do you have any questions or concerns about the medications or the pain management plan we have outlined?
Now look at question 30.
Today, I will be discussing patient confidentiality and social media, a critically important area in healthcare. As healthcare professionals, it's essential that we understand the boundaries and legal implications of sharing patient information. Any breach of confidentiality, especially through social media, can have serious consequences. Even seemingly harmless comments can violate patient privacy and expose our facility to legal action. Always consider the sensitivity of information before sharing anything online. Let's review some scenarios where confidentiality could be compromised and discuss proper ways to handle such situations. It's not just about following the law, it's about maintaining trust with our patients and upholding our professional ethics. What are some challenges you think you might face in maintaining confidentiality, especially with the prevalence of social media? It's important for us to anticipate these challenges and have strategies in place to address them effectively.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello, everyone. Today, I'm excited to delve into an in-depth analysis of the transformative impact of digital health technologies on chronic disease management. Specifically, we'll explore the utilization of digital health tools in enhancing patient outcomes in diabetes management, drawing upon scholarly research and clinical data. Digital health technologies represent a significant breakthrough in the management of chronic diseases, offering new ways to enhance patient engagement, monitoring, and outcomes. The integration of digital tools in chronic disease management, particularly diabetes, has been a focus of extensive research. A study published in the Harvard Business Review outlines how digital health tools facilitate real-time data collection and patient-provider interactions, which are crucial for managing conditions that require continuous care and monitoring. Let's consider the case of a patient, whom we'll refer to as Mr. Smith, a 58-year-old diagnosed with type 2 diabetes. Mr. Smith's journey underscores the crucial role of digital tools in managing chronic conditions effectively. Initially struggling with fluctuating glucose levels and poor medication adherence, Mr. Smith was introduced to a digital diabetes management app by his healthcare provider. This app was designed to track his daily blood glucose levels, dietary intake, and physical activity. Research from the Journal of Medical Internet Research supports that real-time data tracking empowers patients by providing immediate feedback and actionable insights. For Mr. Smith, this meant receiving notifications if his blood sugar levels deviated from the norm, coupled with dietary suggestions tailored to his specific health metrics. The personalized feedback mechanism helped Mr. Smith make informed decisions about his health on a daily basis. The impact on Mr. Smith's health was profound. Over a period of 6 months, there was a notable improvement in his HbA1c levels, a key indicator of long-term glucose management. This improvement aligns with findings from a study in Harvard Health Publications, which reported that digital health interventions could reduce HbA1c levels by an average of 0.5% in diabetic patients. Moreover, the integration of artificial intelligence into these digital platforms offers another layer of sophistication. AI algorithms can predict potential health risks based on data trends, enabling preemptive medical advice. In Mr. Smith's case, the app predicted a potential spike in his glucose levels triggered by his dietary patterns. This prediction prompted a consultation with his endocrinologist, who adjusted his treatment plan accordingly. Beyond individual patient care, the aggregation of anonymized patient data can lead to improved epidemiological insights and more robust healthcare strategies. According to a Harvard Medical School study, big data analytics in healthcare can identify trends, improve disease surveillance, and tailor public health interventions more effectively. This could mean more targeted outreach programs and better resource allocation to high-risk populations. However, the journey towards fully integrating digital health technologies into chronic disease management is not devoid of challenges. Issues such as data privacy, cybersecurity, and the digital divide pose significant hurdles. Ensuring robust data protection mechanisms and equitable access to these technologies are imperative for realizing their full potential. Equally important is the need for regulatory frameworks that support the safe and effective use of digital health tools. Regulatory bodies must work closely with technologists and clinicians to ensure that these tools meet stringent safety standards while being flexible enough to innovate. The balance between innovation and regulation is delicate but essential for the advancement of digital health. In education and training, healthcare professionals must be equipped with the necessary skills to utilize these digital tools effectively. This means integrating digital health education into medical curricula and providing ongoing training for existing healthcare workers. By doing so, we ensure that the workforce is not only proficient in using these tools, but also adept at addressing the unique challenges they present. The case of Mr. Smith illustrates the transformative potential of digital health tools in managing chronic diseases like diabetes. As healthcare professionals, it is incumbent upon us to leverage these technologies to foster a more proactive, personalized, and preventive healthcare landscape. By doing so, we not only enhance patient care, but also contribute to the broader goal of health system sustainability.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome everyone to today's advanced clinical seminar. Our focus today is on a complex and critical issue in internal medicine, hyponatremia, a condition that despite its frequency can present significant challenges in diagnosis and management. We will also delve into a relevant case study that underscores the complexities of managing this condition effectively. Hyponatremia, essentially low sodium concentration in the blood, is the most common electrolyte disorder encountered in clinical practice and affects approximately 15 to 30% of hospitalized patients. The normal serum sodium level is between 135 to 140 millimoles per liter, and anything below 135 millimole liter is considered hyponatremia. The pathophysiology of hyponatremia involves a disruption in the body's sodium-water balance, which can be caused by a myriad of underlying conditions, ranging from simple fluid imbalance to severe organ dysfunction. One critical aspect of managing hyponatremia is understanding its classification, which can broadly be categorized based on volume status: hypovolemic, euvolemic, and hypervolemic. Hypovolemic hyponatremia occurs due to actual sodium depletion in the body, commonly caused by gastrointestinal losses or renal losses due to diuretic use. Euvolemic hyponatremia, which does not involve overall fluid loss but reflects a dilutional state, is often associated with syndrome of inappropriate antidiuretic hormone secretion, SIADH. Hypervolemic hyponatremia is typically seen in conditions like heart failure, liver cirrhosis, and advanced kidney disease, where despite the overall excess of body water, sodium content is insufficient for dilution. Let's consider a pertinent case study to illustrate these points. The patient, a 73-year-old female with a history of chronic kidney disease and hypertension, presented to the emergency department with confusion and headache. Initial lab tests revealed a serum sodium level of 128 millimoles per liter, categorizing her state as moderate hyponatremia. Her clinical examination indicated euvolemia without overt signs of dehydration or fluid overload. Further investigation into her medical history revealed regular use of thiazide diuretics for blood pressure management, which was a critical piece of information. Thiazide diuretics are well known for causing hyponatremia through increased water retention, potentially triggering or exacerbating a state of SIADH. In addition, the patient's chronic kidney disease suggested a diminished capacity to excrete water, compounding the risk of sodium dilution. Management of this patient required a cautious approach to correcting sodium levels to prevent the rapid rise in serum sodium and avoid the risk of osmotic demyelination syndrome, a serious neurological condition that can occur with too rapid correction of sodium. Initial treatment focused on discontinuing the diuretic therapy and restricting her fluid intake to less than 1.5 liters per day. Over the next 24 hours, her sodium levels were closely monitored, showing a gradual improvement to 132 millimol. For ongoing management, understanding the root cause, likely diuretic-induced SIADH, was crucial. It was recommended to switch her blood pressure medication to one that does not influence sodium levels. Additionally, education about appropriately managing her fluid intake and regular monitoring of electrolytes were advised to prevent recurrence. This case underscores the importance of a thorough evaluation in hyponatremia cases, considering all potential causes and carefully crafting a management plan that addresses the specific underlying mechanisms. For medical trainees and practitioners alike, remembering that behind every electrolyte imbalance, there could be a web of contributing factors is crucial in internal medicine. While hyponatremia may appear straightforward on the surface, its management requires a deep understanding of its pathophysiology, a meticulous approach to diagnosis, and a nuanced strategy for treatment tailored to individual patient contexts. Remember, the key to managing complex medical conditions like hyponatremia is not only in balancing electrolytes, but in balancing the depth of our understanding with the breadth of our clinical acumen. Thank you for joining today's seminar, and I look forward to our next discussion where we continue to unravel the complexities of internal medicine.